Good morning. This is Valerie Leonard. I am the founder of Nonprofit Utopia, LLC. I want to welcome you today. Thank you so much for joining us. And before we start, I just want to ask you if you're here to post your name, where you're from, if you have any experience in terms of working with COVID-19 outreach, any questions that you might have. And after the presentation, I will be sure to answer those questions. We also have a link to our Nonprofit Utopia Capacity Building Blocks Intensive. It's a 5-month course, and you will see a link to that in your chat section. So if you're interested, please feel free to email me at ValerieFLeonard@nonprofitutopia.com. And without further ado, I just want to let you know why we're doing this. I noticed that a number of people that I work with, either as an associate or a consultant, a number of you are doing significant community outreach with COVID-19. You're knocking on doors, you're making sure that your neighbors are well, you're checking in on your students and all that good stuff, and making sure that people wear masks and making sure they have food, and all of that stuff is very good. However, we need to make sure that in your doing this good work, that you're doing it in a manner that is sustainable and can attract more funders, right? And when we talk about that, we're talking about making sure that your work is grounded, first of all, from mission and the goodness of your heart, but you also want to make sure that you have data to support the fact that your organization is in fact making an impact. So one way to do that is to make sure that you have a theory of change that takes into account what's going on in the community. But before you even do that, you need to make sure that you have a community needs assessment. And we're not going to talk so much about the community needs assessment today. We're going to talk about the theory of change. But just know that before you do your theory of change, you need to have a community needs assessment in place. And what a community needs assessment does is help you do what we would call a scan of the community, knowing who's in the community, how many people are in the community, how many people might be experiencing issues from the topic that you are covering, knowing the issues of the community. And for COVID-19, for example, if I were to do a community needs assessment with COVID-19, one of the first things I would do is check statistics for the Illinois Department of Public Health. They do maps that give you an indication of how the disease is impacting various communities. So they have drilled down to the zip code level, so you can really get a sense for how the disease is impacting your community. You can get a sense for how well off you are or how bad off you are relative to other communities. So I would want to really get a sense for how the disease is advancing in my community. I would also want to know who else in the community is doing work to address issues of COVID-19, because this is such a massive issue. No one organization can do it alone. So you want to find out who's doing what, where the gaps in the service are. If there are issues with quality, you want to know how those issues can be addressed. If need be, and I would strongly suggest, you would want to not only know who's out there doing this work, but you want to know ways you can partner and partner in ways that you can create a bigger impact. And if you don't have partners such that you can impact the whole community, make sure that the target area that you are trying to impact is small enough that you can really manage it and make a difference, right? So that could be a couple blocks in the neighborhood, and you can use census tracts. You can use census blocks, which are not quite the same as a street block. You can look at a whole area in a community. You could do a whole community. You can do several communities. It all depends on what your capacity is. So you need to develop a target. You need to have a target area. you need to know what resources are available. And then you need to know the issues, right? So those are the types of information that you'll need before you even do your theory of change. And there is a video. If you go to our YouTube page, we have a video on how to conduct a community needs assessment and also strategic planning. But right now we're focusing on the theory of change. And the reason why this is so important is you have to get to the point where you can really understand what your funder is looking for, know the language that they're using, and you can position yourself in a way that you are of best use to them. And to the extent that you can get your theory of change together, get your program logic model together, which we're not covering, there is also a video on program logic models that you can use to develop your programs. Again, we're not necessarily focusing on program today, just your theory of change, looking at ways that you can determine cause and effect, and that lays the groundwork for creating programs that can really, really make a difference and that will be grounded in data, right? While you maintain your personal touch. All righty. So before I go into the program, I just want to acknowledge a couple people who have joined us, and I thank them. We have Robin Martin Berryhill. Hi, Robin. How are you? She is with Resurrected Life Church International and the Chicago Mayor's Office. We thank you so much for joining us. And the Mayor's Office, the Chicago Department of Public Health, that's another excellent resource for getting the data that you need in order to justify. We all know that there's a need to address COVID-19, but we need to be able to quantify the need and be very, very specific about where the problems are and how we're going to address. All righty. And Leighton has a question. What's the best way to get IDPH and Cook County health condition maps and make them available? Neighborhood, school, and wider community life and tech hub areas. When I look for maps, I typically go to IDPH. I know that there's a page of resources on COVID-19, and they actually have mapped the issues all the way down to the zip code level, letting you know how many people tested positive. The data might even include deaths. It's been a while since I looked at the maps, and I believe Chicago has something similar. So if you go onto the IDPH website and look under COVID-19 resources, you should be able to find them. And then the same for the city of Chicago. If there's time, I will do a search online and show you how I would go about looking for it. All right. So, but in the meantime, I want to share my screen and share the presentation. All right. And I promise you this won't be long. I just want to make sure that you have okay, I'm sorry. I just want to make sure that you have the presentation. And I think I did something wrong there. Let me try it again. Share my screen. And I want to get to the application. All right. So all right. So we're going to talk about a theory of change for COVID outreach. Again, we're talking about making sure that your outreach is grounded in theory, not so much to a point where you're trying to, where you would need a PhD to understand what you're doing, but you want to be able to position your work in such a way that is sustainable. And when I say sustainable, you want to create a system where that you can speak in the funder's language. You can show that you're addressing a problem, that there's a need as well as a demand for your services. There's quality in your services. There is a direct, there's intentionality about bringing about change, and you have the systems in place and the capacity in order to do this for the long haul. If you're anything like me, you might respond to changes in the community, but if you don't really think through it in terms of how does this outreach last beyond 2 to 3 months, which I have been guilty in the past, just trying to make sure that I could address the situation, you miss out on opportunities to attract more funding because you're not, you haven't thought about how you're going to capture those outcomes and the changes you're making. You're just focusing on filling a need, and that's well and good. But if you can't prove that you've actually made a difference, it's very difficult to justify getting funding over the long haul. All right, I want to give you a little bit of information about Nonprofit Utopia. We're the ideal community for emerging nonprofit leaders, and we do that through coaching. We've got an online community, and we also do consulting, providing consistent professional development. And our mission is to develop the next generation of ethical nonprofit leaders. And we want to impact the global nonprofit sector by training up to 50,000 nonprofit leaders between now and 2033. And live streams like this one is, one of the ways that we do it. Give you a little bit of information about myself. Again, I'm the founder of Nonprofit Utopia. I am on staff at UIC, teaching courses in nonprofit management, as well as with Roosevelt University. I've also developed a 5-month series, Capacity Building Blocks. There's a link to that for you to get to know a little bit more about that program. And we're going to be starting up our Blog Talk Radio show within a couple weeks. All right, so enough about me. What we're going to cover today is we're going to give you a review of asset-based community development. And this is not a presentation on asset-based community development, but we do think it's important for you to at least understand what it is we're talking about, because that's very, very important when it comes to developing a community needs assessment as well as a theory of change. And we're going to talk about, I could give you a definition of strategic planning. We're not going to go into depth in strategic planning. And we will also talk about the theory of change. That's really why we're here. I'll give you a model and then give you an example using COVID-19. All right, so key concepts. When we talk about community asset-based community development, we're talking about community development from the inside out. We're not necessarily talking about having people from, say, the city of Chicago or the state of Illinois or the federal government coming in and doing a plan, although they do planning for the community. We're talking about people who live in the community, who are assessing the issues themselves, keeping tabs on the issues, identifying outcomes that they'd like to achieve. So using what you have in the community, so that could be people, that could be organizations, that could be institutions, block clubs, churches, parks, looking at whatever you have and the roles that they can play in solving the problems that you want to solve. And basically, the idea behind this is every community has everything that it needs in order to solve its own problems, regardless of the way it looks on the outside. So you want to make sure that you involve the community when you address your COVID-19 outreach. And you want to go beyond outreach to actual programs. Outreach is a service, and the difference between a program and a service is a program has definite goals and objectives and intentionality around making changes. A service we know is in the best interest of the community, but we're not necessarily measuring change. We're really focusing more so in terms of the numbers of people served. And we know that we're doing good work, but we really can't prove that we're making a difference. So that's the difference between a program and service. So you want to move from the point of providing just services for COVID-19 to actually developing solutions that will make an impact, make change. So looking at programs and initiatives. So when we talk about community needs assessment, I think I kind of went through it, but the definition is basically a way of gauging opinions and assumptions and needs and all that good stuff. So no need to really go into that much detail about the definition. But as I said before, it's really, really important that you conduct a community needs assessment because you can use it for so many different purposes. You can use it to develop your theory of change that we're going to be talking about here. You can use it for strategic planning. You could use it for proposal writing. You can use it for marketing strategies. You can use it for community organizing around various issues. You can use it to determine whether or not needs have changed over the years. You can look at your programs and see if they're still relevant, and you can collect community stories and hopes and dreams. So there are a number of reasons, and for today, our reason for doing a community needs assessment would be to inform our theory of change. All right, so the things that you need to do in order to demonstrate need are to identify key issues, identify the people who are most impacted, and those can be different groups of people, based on similar characteristics like age, characteristics like gender, character, or even demographics, right? So you can identify gaps in services and you can demonstrate demand. So all of that stuff is really important, and it goes into developing your community needs assessment, which will be the groundwork for your theory of change. So when you do your community needs assessment, you want to define the scope. You want to decide whether or not you want to do this solo. And when I say solo, as a single organization or as a single group of people, or do you want to collaborate? You'll definitely have more impact if you collaborate. The COVID-19 issue is very, very complex, is massive. And as I said before, not one organization can do it all. But if you're going to do it solo, you got to make sure that your scope is narrow enough such that one organization can, in fact, make a change. And so that's what I mean when I say make a difference. You want to be able to demonstrate that as a direct result of the actions that you put into place, that a change was achieved. So you're going to need to collect data to find out what we call a baseline set of issues, and then that baseline will be examined again to see, whether or not you have made any change as a result of your actions. And then you want to determine your key findings, after looking at the community that you want to serve, and the community is going to be defined by a geography. Again, the geography could be a block, it could be a census block, which is a little bit different than a city block. It could be a census tract, which is a group of blocks, census blocks, or it could be the whole community. It could be several communities. It could be the city, the state, federal. But whatever it is, you want to make sure that you have the capacity to address the needs in that geographic area and make a difference. So you want to set priorities and create a plan and share your findings. But again, our focus today is on the theory of change. I only went through that because I think it's important for you to know what you should have in place before you develop this theory of change. So a theory of change, it actually describes the process of planned social change, including the assumptions that guide its design to the long-term goals it seeks to achieve. All right, so you can map the process of the change and you can establish a blueprint for the work that's ahead, and you can actually look at cause and effect. And there's no one way to do this. You just want to make sure that you're communicating, that you have a good grasp for the issues. You want to communicate the assumptions that you're making, and you want to show cause and effect. And this theory of change should also help you to understand what data you're going to need to collect so that you can prove that you're making a difference. And it's a little bit different from a logic model, which is what you would use to begin to develop your program. And we're not going to go into the logic model. We're just talking about the theory of change, but it could really, really help you in terms of communicating what the problems are, cause and effects, and how you can actually make a difference. So it also sets the stage for your evaluation because it lets you know what it is you're going to be evaluating, when and how. All right, so this model, you may have seen this before. This is from Development Impact in You, or DIY. Again, there are several models. I went through three last spring, and I'm just going to focus on this one. I think it's relatively straightforward and simple. So you basically want to clarify your priorities by determining your goals and your path to reach them. So this is assuming that you already have a goal in place, and then you answer the question, what's the problem that you're trying to solve? So you want to be able to summarize that problem, at very high levels, you know, just because, we don't have a whole heck of a lot of room on this one page, but at very high levels, what's the problem? And then who is the key audience? And when we talk about audience in this case, the audience is also your target. Who are you trying to impact? And that could be impacting with the message, it could be impacting with a program, it could be impacting with a service. All right. And what is your entry point to reaching your audience? So, what's your channel, right? How are you going to communicate to them? How are you going to actually reach them so that you can bring them in and deliver a service? What steps do you need to bring about the change? And then you want to know, what's the measurable impact of your work, right? What's the measurable effect? And there may be more than one way for you to measure your progress. And then you want to look at the benefits of your work. Who is benefiting? And then over the long term, what is it that you want to see change as a result, a direct result that you can say is coming from the work that you have done? And then you make key assumptions. When we talk about key assumptions, these are the things that have to be in place in order for you to be successful. So next, I'm going to share with you an example with HIV, a community neighborhood-based uh, situation over in England, and then I'm going to share with you some ideas that I have about COVID-19. And then I would love to hear from you, what questions you might have, and how you're going about addressing COVID-19. So again, this is an example from HIV, and then the next slide is going to be an example from COVID-19. All right, so in this case, the problem that they're trying to solve is, trying to make sure that the women who experience HIV, that they're not necessarily stigmatized, that they can actually find work and walk about freely in the community without stigma to them or their children. All right. So, one of the problems in this community is understaffed health centers. Another problem is HIV stigma, and then the fact that you have 700 children affected daily. And we're only going to solve this problem if there's no cure for HIV and if the problems are still relevant. So basically, this is saying we're going to be in this for the long haul. We're going to continue our outreach efforts to women and their children with HIV until the problem no longer exists. So, who are the key audiences? They're women who have children and they also are HIV positive. They feel empowered. So you want to be able to work with empowered mothers so that they can mentor the HIV mothers who don't necessarily feel empowered. And then the target is also children of HIV positive mothers. And you only want to focus on them if mothers need work and the mothers care about it. And this is important. You don't want to be more enthusiastic about helping your population than they are about improving their own conditions. All right. And sometimes you actually have to do education to make them feel more empowered and help people understand the seriousness of the issue. And then this next column is, the entry point. So at what point do you um, interface with the understaffed medical centers? You do it through the medical center itself. And if there are any satellite clinics that you're working with, you also uh, encounter them there. The HIV stigma, you want to talk to the local government because it's actually the local government in this case that has a real role to play in terms of whether or not people are stigmatized to the point where they can't go to work. And then you also want to look at your national governments, and you only work with these stakeholders, they all have a stake in this issue. You only work with them if they care about it and if they need staff, because you want to, part of this program is to bring on HIV positive mothers and make sure that they have work. So, and then two, you want to also find mentors, volunteer mentors, and sometimes a medical center. Obviously, a medical center, their job is not social work, so you want to bring on volunteers to help them do some of that outreach. So some of the steps that you're going to need to bring about change, you're going to have to train mentors. You're going to have to have a campaign to increase local awareness of HIV and some of the issues. And you really do want to highlight the problems that the HIV positive mothers and their children are going through. And then you want to be able to organize support. And one of the ways you do that is to make sure people know what the problem is. And you only do this if the mothers are willing to put themselves out there and be trained, and you only do it if there's no stigma amongst the government. The government is not going to be a good player if they're stigmatizing folks with HIV. And then when we look at the measurements, so what are some of the ways that we know that the work is working? We use measurements. So you measure things like the number of mentor mothers who are ready to help. You look at the number of HIV positive mothers who visit the medical center and actually get help. Because notice we're looking at things too that are Notice we're not just doing activities, we're doing activities that will change conditions. And then you're looking at the mentoring program. It goes from being a local community program to being scaled across the country. And this can only happen if the staff can train mentors, and that if you're in a developing country, that there's peace in that country. So there has to be conditions that will bring about success. All right. So what are the wider benefits of your work? Women get work and they get extra money. The women actually, who have HIV, they feel empowered and they're healthier. And then all HIV positive mothers get treatment. And this can only work if the mentors are actually needed and and sufficient medical supplies are in stock. Excuse me. And then what is the long-term change that you want to affect? All right, you want to improve the health of HIV positive mothers and their families. You want to reduce the stigma, and you want to eliminate pediatric AIDS altogether. So the only way this can happen is the mentor mothers and HIV positive mothers are working together, and that they got some support from the medical centers. All right. So using that model, here's some ideas for ways that people can address COVID-19 in their own communities as a community, right? And again, you're working with the people in the community. That's not to say that you're not going to work with folks at the city level. It's not to say that you're not going to work with foundations and all that other stuff, but you want to first start with the people in the community. So one of the problems is the spread of COVID-19 is uncontrolled, right? And there's a disproportionate impact in Black and Brown communities. And if you look at some of the hardest hit areas, if you look at the IDPH map, you will see that those zip codes, many of them are in Chicago on the southwest side and the west side. Another problem is students are behind in school. As a result of school closures, they can't really engage in classroom activities. They're going to class, at least the kids in public schools, they're going to class online. Many of the students are not prepared to study online. They don't necessarily have computers. They don't necessarily have the orientation and study skills. And that's not to say that they're less intelligent, but if you're not used to studying online, that's going to be a culture shock for you. It takes a while to go from in-class learning to online learning. And, truth be told, it was a culture shock for the teachers, right? Culture shock for us all, the parents as well. And another problem is people have lost jobs as a result of shutdowns for their jobs. Some businesses have gone out of business altogether, and some have slowed down. There's a slower economy, and they also have to do business in a certain way, and that might also impact the amount of business that they can do. So you're only going to try to work to solve this problem if the problem still exists. So a key assumption is whatever is going on in the community is still a problem. So who is the key audience? I didn't have enough space, so I just put community stakeholders. Your community stakeholders can be anybody who has a vested interest in this problem. But here you also want to look at who might your target be? It might be kids who are in school. It might be people who have COVID-19, people who are at risk at getting COVID-19, people you want to work with to prevent from getting COVID-19. So those might be some of your targets. But some of the other community stakeholders that you might want to partner with would be other organizations. It could be the Illinois Department of Public Health. It could be Chicago Department of Public Health. It could be your local hospitals and doctors. So you think about the different people you need to reach, the messages that you need to have for them to get them on board, and then also to get them to participate in activities that will actually reduce the spread of COVID-19. So these could be, in some cases, parents, students, and principals, people who are unemployed, who live in the community, or business people who have lost their business or they're in danger of losing their business as a result of COVID-19. Or it could be heads of nonprofits who have some expertise in helping those businesses. And then when we look at our entry point to speaking with them, it could be homes. There are people who go door to door with face masks on, delivering different, delivering food or disseminating information. You can reach people through telephone, social media, bus stops, train stops. For the students, you can reach their parents at home. You might be able to reach a school administrator in the school itself, calling them at school. Obviously, the telephone. You could reach them through social media and public bus stops, train stops. And again, you pretty much, in this environment, you're limited to the ways you can reach people. There are very few public meetings that are going on, and many of those public meetings are online. So if your elected officials are having town hall meetings, if there are community groups who are having town hall meetings, you might consider asking if you could be on their agenda to talk about the work that you're doing. So this can only work if you have outreach workers who are willing to do all of this legwork, right? And that the stakeholders are receptive. And then when we talk about the various audiences or the targets, you can only target people and have success with them if they're ready for change, right? People who are not ready for change, you can talk until you're blue in the face and it may not be worth your while, right? You hate to say that, but you want to do your best to educate them and re-educate them, but you really want to work with people who are compliant. So what are the steps that are needed to bring about change? Obviously, you need health education. Everybody needs to understand what COVID-19 is, how it spreads. They need to talk about the behaviors that encourage safety and discourage the spread of the disease. There needs to be rewards for people that comply. And when we talk about rewards, that could be things like recognition, hold people up as role models so that other people can look up to them and see other people who are engaging in healthy behaviors, and hopefully they will start taking on those same behaviors. You should also have sanctions. Now, the sanctions, you as an organization probably can't provide sanctions because that's really not what you do. You're not part of, you can't really enforce things unless they're with your employees, right? Or with people who participate in your program. So there have to be negative consequences for not complying. But here's where your partnerships with your government officials come in. Your government officials they have the ability to provide sanctions. So if there's a business that you know of that's not engaging in healthy practices, you contact the City of Chicago, Department of Business Services, and they're working very closely with the Department of Public Health, and they can deal with that issue, right? Other things that are needed in order to make change, when we look at our students, our students need computers, they need tutoring, they need parental support. And when we look at people who have lost their jobs as a result of COVID-19, now is a good time for them to learn new skills, new technical skills, and other skills to hopefully prepare them for the next job, and hopefully that next job will pay more money. You'll provide job training, job placement, and even work with your local officials to bring in new employers. Right? This is a good time, believe it or not, to start laying those plans. And then the same thing with businesses. You want to work with businesses that have closed their doors or in danger of closing their doors, and you want to help them retool. You want to help them to get the skills that they need to survive in this community. It may mean understanding better how to use technology to their advantage, right? It may mean pivoting. They may have to open up a new line of business using similar skills. So that kind of thing. And that can only work if your outreach workers are skilled not only in outreach, but they also are skilled in referrals. They have the ability to encourage those referral partners to actually follow through, right? You need cooperative government agencies as well. So, what are some of the measurements that you can look at? Um, you'll look at the number of people practicing safety, and you might not necessarily be able to get to an exact number, but you'll be able to make observations, kind of look at what's happening when people start, and then look at what's happening after they're educated. So you might find this information out through observation. We look at social media and see people walking around with no masks. If over time you see that behavior has been reduced, that's a good indication. A better way to capture it is if you conduct surveys, a pre and post survey, get a sense for what people's behaviors are before you bring about your education and intervention, and then look at what their behaviors are afterwards. And then you also want to look at how many people have been tested before and after your intervention, how many people have been vaccinated before and after. And at this time, the number of people who are vaccinated is probably zero unless you're talking to people who are on the front lines in healthcare. But those are some of the measurements that you can use. And that's going to vary from organization to organization. It all depends on what your goals and objectives are and what you're trying to achieve. For the kids, a measurable effect is or the students are returning to school. And another measurable effect, you might see that they're actually improving in their homework scores. Again, that's going to be determinant on what it is you're trying to achieve. For the businesses that have shut down and for people who have lost their jobs, a good measurement is the number of people who return to work and learn new skills. It could be the number of businesses that are saved, the number of businesses that get new financing, number of businesses that open, number of businesses that actually pivot what they're doing so that they're now more prepared for disaster preparedness. And that could also be one of your interventions, training on disaster preparedness, number of people who go through it and actually make changes to the way they're doing their work as a result. All right, so the only way that's going to work is your stakeholders in the community have to be compliant. They have to be willing to work with you. They have to be willing to accept being tested and being vaccinated. And that's going to be a huge issue in the Black community. You know, we've had a horrible, horrible experience with public health and being used as guinea pigs for experiments to make sure that drugs work. So, how do you get past that stigma, that history, and get people to trust that these vaccinations are going to work? You know, that's going to be a big part of what you do. So, what is the wider benefit? You know, hopefully the spread of the disease is slowed, you know, because people who are more educated, they actually are, if they're more educated and they comply, their behaviors change so that they're engaging in safer behaviors. You know, if people are vaccinated and tested, you would hope that you capture all of the people who, and when I say capture, you have a good number for the people who actually have been tested, the ones who are positive, and the people who are vaccinated. And hopefully, you know, after that, you know, the disease is slowed. When students return to school, you know, the benefit to that is, you know, the students resume learning. They also resume socialization, you know, because, you know, it's very hard to be sociable when you're cooped up in the house, right? You really your social skills take a hit. So hopefully they'll also make up for lost time. And then the wider benefits to helping people who are unemployed and the businesses who are struggling is you'll see people gainfully employed and the businesses are stabilized. And the only way this can work is if everybody in the community realizes they have a role to play in making sure that we get rid of COVID-19. And I think we have a ways to go. I think in most cases we feel that we're not equipped to address the issue. But the truth of the matter is we can all do something. And then the last question is, what's the long-term change you see as your goal? And hopefully you'll see a healthier community. You'll see people who are more engaged in their health, you know, because when you think about it, when we as residents go through what it is that we need to do to educate ourselves, to be more compliant so that we don't get the disease. And when I say more compliant, that means we're getting our vaccinations, we're getting tested, we're engaging in safer behaviors. That lesson is not just for COVID-19. You know, the lessons that you learn with COVID-19 can also be easily transferred to, say, diabetes, heart disease. You know, the community itself becomes much more aware of its health status, and they'll be more receptive when it comes to, you know, those other issues. All right, another long-term goal is, you know, we see students graduating and they're moving on to the next level in their development. You know, if we don't address this problem, the students continue to be stagnated and they're losing the learning that, you know, that they need in order to progress to the next level. When we have people who get new jobs, get new training, we're hoping that one, they are increasing their wealth, they're increasing their income, and that the homes become more stabilized as a result, right? They don't have to lose their apartment or lose their homes as a result of not having a job. And then the kids can stay in one school rather than having to transfer. And hopefully the local economy is improved because when people are employed, they can then have money so that they can patronize the local businesses, right? So again, in order for this to work, you have to have all hands on deck, and everybody has to do his part. All right. So I'm going to open it up for questions now. If you have any questions that you want to follow up with me on, you can email me at ValerieFLeonard at ValerieFLeonard at MSN.com or ValerieFLeonard at NonprofitUtopia.com. All right. And if you're a member of the Nonprofit Utopia community, we will be sharing this template in the community and you can use it to do your own brainstorming. All right, so I'm going to stop sharing and open it up. And hopefully there's some questions waiting for me. Okay. Okay, Robin is just clarifying her representation. She was tagging the city of Chicago. She wasn't representing that she worked for them. And I misunderstood. All right, so thank you so much for bringing that to our attention. All right, so at this point, if there are any questions, can you let me know? And I'll do my best to answer them. All right, feel free to post. And I'm going to see if I can, while you're posting, I'm going to see if I can find that page on IDPH's website. All right, so I have found the website. I'm going to share my screen. All right, so what I did to find this was just type in IDPH, and that's Illinois Department of Public Health. I did IDPH COVID-19 statistics, and I came to this page. So here's the very top of the page. And, this area here, they always have a message. And they indicated that Tier 3 mitigation freeze was released. So if you know anything about the state of Illinois, we're all in different regions, different tiers, based on the number of cases for COVID and the associated risk of spreading the disease. So according to IDPH, they're what, 1.01, over 1 million cases of COVID-19, and we've had over 18,000 deaths and about 1,800 probable deaths. So I'm assuming that these are deaths that they think might be from COVID-19 complications, but they really can't be 100% sure, but they obviously have data for 18,000 people. They have performed 14.9 million tests, and they're also showing that 98% of the people who are affected actually recover. All right, so this is the map I was telling you about, and true to form, the darker the blue, the more concentrated COVID-19 is in that area, and the lighter it is, the less concentrated. All right, so you could go all the way down. I believe these are by zip code, or is it? Yeah. So they have everything mapped out by zip code. So you can go to 60625 and you can see they have 5,662 cases. in area code zip code 60035, they have 1475. Here in zip code 61259, they only have 65. All right, so you can put your zip code in. I'm going to scroll down to my zip code. Shucks, if I can get down to 606. I'm looking for 60623. But at any rate, there's a drop-down menu. For some reason, I'm not able to make this work. There's a drop-down menu, and I think it's on my end and not IDPH's end. I'm just going to go to the first zip code, right? So you put in that zip code, 6010. Something's supposed to happen. I don't see where anything has happened, but you see the interactive map where you can hover over different zip codes and you get the information. And just know that, the darker the area is, the more, the higher the percentage of cases they have. And the lighter, the lower. Okay? So are there any questions? Any comments? All righty, so I want to say thank you so much for joining us. And we will show you how to do a program logic model, as well as how you can put together a collaboration in order to do this work more effectively. All right, I shall talk to you later. Take care. All right, bye-bye.